Sarah, you are a doula, a hypnobirth instructor, and you have recently deregistered as a midwife. Can you share with us what led you into the birth space to begin with, and where are you now?
Firstly, thanks for having me. I love doing these chats. One of my favorite things to do. I kind of knew that I wanted to be kind of in the, I guess, healthcare space. I was very interested in biology and how the body works and all that kind of stuff. And also my youngest brother was born when I was 10 years old. So I was very involved and very interested in my mum's pregnancy and then when she had him and looking after him and all that kind of stuff. So when it came time to kind of decide what I wanted to do after high school, I was chatting with my mum and I'm like, well, I love learning about the human body and all that biology stuff. And I also love babies. And she's like, well, why don't you study to be a midwife? And I'm just like, oh, like what's a midwife? And she explained all that to me. And so then, yeah, I jumped in, studied nursing and midwifery. I did my double degree. I started that in 2011, which was a 4-year double degree. And I loved it from the first day of uni. I was like obsessed. I loved learning about everything. I loved all my placements. As soon as I started doing it, I'm just like, yes, this is 100% for me. Like it was just meant to be. So that's how I kind of got into it. And then I got a grad spot at one of the best, tertiary hospitals in Victoria and did my grad year there and then continued working there after that. I had my first baby, who is my daughter, nearly 9 years ago, and I birthed her at the hospital that I worked at. And then things kind of started changing when I got pregnant with my son, which was in 2019. I was still working at the hospital, but when I got pregnant with him, I then decided I was 100% going to birth him at home. Even before that, at work, we'd have like the birth board in birth suite and working on the postnatal ward. And there was all of these little things that just started popping up that kept making me think like, is this right? Because there were so many cesareans and there were so many inductions, and it was kind of like a unicorn birth where a woman would just come in and have her baby with no epidural, no forceps, no vacuum, just come in as a first-time mum, birth her baby, and be happy about her experience. It was like literally a unicorn birth. It hardly ever happened. And then I started really not enjoying working in the birth center. And so I actually took myself off the roster for birth center because I just couldn't handle it anymore. It was very stressful. It was very cliquey in terms of the staff as well. And I just felt like I was so out of my depth. I just wasn't on board with the policies and the guidelines, and I just felt really wrong. So I stopped working there. And then I was thinking, do I even want to be a midwife? If I don't even want to work in the birth suite and support women birthing their babies, how can I want to be a midwife if I'm not even wanting to do that? So then I was like, maybe I'll look for something else. I'll just, change careers completely. But then I left and had my son at home. It was a very quick, very intense birth. There was like hardly any intervention. It was just, I'm like still on a high when I think about his birth and all that kind of stuff. After I had him, COVID kind of came in the next year in 2020 when I was due to go back to work. And I was just like, I'm not feeling that. I don't want to be in hospital supporting women wearing a whole hazmat, suit and women not being able to see my face or to see me smile and having to uphold all the rules and regulations around the policies with COVID and, telling partners that they can't be, with their wife or their partner and telling them to go home. And it felt really wrong. I just couldn't, I don't think I would have been able to do that. So I kind of just quit my job. And then I'm just like, I really want to be doing something in that space. So I'm like, well, why don't I start teaching? When I was working as a midwife, I loved having students with me. I loved teaching. So I'm just like, maybe I'll just do childbirth education. So I started teaching the Hypnobirthing Australia positive birth program. And I absolutely loved that training. I loved it so much. I loved everything about that course. And I believe in it 100%. So a lot of the things that I was going to teach women from this course were a lot of the things that I did in my pregnancy with Raf, where I had the home birth, and a lot of the techniques that were taught, I actually did in my labor without knowing, or being taught those kind of techniques. So I'm just like, this is just like it's meant to be. And I started seeing such beautiful, positive outcomes coming from women that were doing this course. And I don't, credit me. I credit the information, the education, empowering women, giving them all of the knowledge that they need to be able to make all of the decisions and have the positive birth that they deserve. And all of these first-time mums that were coming to do my course were then telling me about their birth stories, and they were all like spontaneous labors. There was no medical pain relief. They had their babies naturally, and they just absolutely loved their birth. And I was like, after a couple, I'm just like, oh my God, that's amazing. But then one after the other, after the other, after the other, I'm then, left with, when I was working as a midwife in hospital, I never saw births like that. I never experienced women talking about their labor and birth as magical, beautiful, positive. And yet now I'm out of the hospital teaching the course, and I'm hearing all of these beautiful, positive, empowering birth stories. And then it just it clicked. And I'm like, this is what I'm meant to be doing, not in the hospital. But then I started getting massive FOMO, because I'm like, I want to be there. I want to see these births. I want to support you in labor. So then I started offering doula support. And once I started supporting women like that, I'm like, this is midwifery. This, again, speaking about how I didn't want to be in birth suite or birth center and look after women while they were laboring and birthing in hospital, made me feel sick, to then experiencing authentically supporting women and serving them as opposed to serving the hospital or my registration or the system. That's where again, it just clicked to me. This is proper midwifery, what I'm doing now. So then it was just a no-brainer. And I got in trouble from APRA a couple times. I got, flagged and reported a few times. And I'm just like, this registration is just not worth it for me. So I sent APRA a letter, which they didn't give a shit about, explaining why I, deregistered and the issues, and all that kind of stuff. And I said, you can have my registration. I don't want it. So I gave up my midwifery registration, and yeah, here we are.
I have goosebumps. It takes a fucking strong woman to be able to step outside the system. And that's just not about motherhood. That's about where you are in the system, and then you would have friends inside there. It's worrying about what other people think and stepping away from that, being like, I just need to be in my true authenticity and be true to myself, and I have to do what's best and what's right and do it. So I've just got goosebumps. So what's the biggest difference you see and in the outcomes from birthing inside the hospital and at home, regardless if someone's done a hypnobirthing course?
Your body and your nervous system, whether you're actively conscious of it or not, your body feels safer at home. At home, you've got familiar smells. It's where you are your whole time. It's your safe place at home. But when you go into the hospital where there's, bright lights, there's different smells, there's strangers, you're being monitored, it's, there's machines beeping and all that kind of stuff. It's a very medical environment. And again, whether you're conscious of it or not, your body and your nervous system kind of don't feel as safe in that kind of environment. And that's for majority of women. Yeah, and it's not to say women can't have a positive experience in hospital, because you definitely can. But I think that you're working harder to achieve that type of experience or that type of birth when you are in hospital compared to being at home.
Do you see there's a correlation between the length of birth from home to in hospital? Because if your body is subconsciously in that state of not feeling safe, even though the mind's like, I'm safe, these people are the safest people and they know what they're doing, they're professionals. Do you reckon the body holds on to a baby differently at home to in hospital?
The way the hormones work, yes. I think a lot of women, if they've experienced labor and they've birthed in the hospital, a lot of women will see kind of a slowdown or a little bit of a lull in their labor when they leave their home to then go to the hospital. And things kind of slow down in that period until they get more comfortable in their room and all that kind of stuff. And that's just because of how our hormones work. So I think yes, to a certain degree, yes.
Okay. What's the biggest misconception do you reckon people have about birthing at home?
That it's dangerous, I guess, or more dangerous than birthing in the hospital, which there's been countless studies that show birth is just as safe or more safe being at home than in the hospital. I think a lot of people think when they think about home birth is like a woman, you know, um, dancing around outside birthing like in her backyard. Do you know what I mean? Where it's not like that, especially when you're hiring private midwives. You know, you basically have all of the emergency equipment that you would need being brought to your home. And then if you're also hiring private midwives, they do have that medical training and that medical knowledge that if there was an actual proper emergency, that, you know, they would be able to do things. And it's very rarely, I believe my opinion, is that even if there are emergencies at home, very rarely is it just life and death. It's not like that clear cut. There's always going to be red flags that kind of pop up that will kind of, you know, it'll be in the back of your head like, maybe this doesn't look right. We'll just keep an eye on that. And then if something else happens and something else happens, it's just like, okay, yep, something is not right here. We need to kind of do something about it. Or, you know, people are terrified of bleeding out after birth. Whereas again, it's not just, you know, in that split second, someone's going to die. Yes, bleeding can happen quickly, but, you know, there's always things that you can do for that. And again, that's why we have healthcare professionals in a hospital, and you can call an ambulance if there's, you know, those medical emergencies that happen. And so all of that information is kind of targeted to women who are, I guess, just new in that and maybe have that at the back of their head. Oh, I'd like to home birth, but, you know, they're not on like the hardcore side of the spectrum, but just thinking about, you know, the difference. There are so many things you can do to have that safety net if you wanted that. Yeah, it depends how you kind of look at labor and birth and your perspective and that kind of stuff.
Do you think there's not a lot of healing that needs to be done around women trusting their bodies to be able to feel safe in the whole birth space?
Yeah, well, that's where it comes from. It's that trust, isn't it? Like we haven't been taught to trust our body or to listen to our body from a very young age. You know, a lot of people, if you're sick, go to the GP, they'll tell you what to do. When you're pregnant, you know, you go to the doctors, the hospital, the midwife, the doctor will tell you what to do. We're not taught to listen to our intuition, to follow the body's lead, and to know that like we're capable of making decisions for ourselves and looking after ourselves and our baby. You know, back in the day, 2-3 generations ago, it was totally different in terms of maternity care and how women would be birthing their babies. And that generation looked at pregnancy and birth as something normal and natural. It's a normal physiological thing that's happening. It's not a, you know, medical emergency that needs to be medically managed. It's just a normal thing that women did. So women trusted that process much more. And these days, I think there's so much more fear and lack of trust that's where it all comes from. Because if I was to ask majority of women, if everything was to go exactly how you wanted, how would you want to birth and where would you want to be? And I would say a vast majority of those women would be saying, I'd love to birth at home and have a natural birth. And it's just that fear and lack of trust that deters them from that. And like Western society and the, you know, the belief we have around pregnancy and birth is that it's, you know, dangerous, painful, and scary.
Yeah, it's baffling. It's baffling the fact that we haven't even really seen birth until we give birth. Like when you think about it, most people have only ever seen birth on movies, and it's always a medical emergency. It's traumatic.
Yeah.
So it's like letting go of that programming, but the programming runs so deep. There's people have so much fear into it, and I wonder sometimes if you haven't gone through all the different rabbit holes there are to go down
Yeah.
to know if you can actually really be safe. Like I know to a lot of my friends, I'm completely crazy and completely woohoo when, yeah, it just to me just seems so natural. I do have a mum, soon to be mum in my DMs at the moment, like, and you can tell in her body she's screaming to free birth, but her partner's not on board. What would you say to someone who just knows she can have the baby at home, knows she doesn't need anybody? Every time she tries to find a private midwife, she doesn't like them, and she's like, I can do this, but her partner isn't supportive.
I guess education. It just comes from ignorance and that lack of knowledge and lack of information and lack of trust. So I think there's a lot of work to do. Women have to do a lot of work during their pregnancy, but it's not just for the women, it's for the partners, and anyone that's going to be in the birth space has to do the work. They have to be committed to do the work. And it's sad that I do know firsthand a lot of women compromise on their wishes because their partners are not on board. And you're just not going to get this experience back. You know, you can't rewind time and do things differently. And I don't think home birth and free birth is for everyone, 100%. But, you know, she could think about still doing what she wants to do. And if her partner wants to be there or not, that's up to him.
Yeah, I'm with you there. I hear all the time, but what if the cord is wrapped around the baby's neck? Is that a danger?
I don't think so. It's like 1 in 3 babies have the cord wrapped around their neck when they're born. I personally don't believe it's an issue. I don't think it stops the birth. When babies are coming out, the top of the uterus is up here. So when the babies are actually being birthed, the top of the uterus is moving down as the baby's coming out. So the cord is also moving down. And, you know, a lot of people are saying, but if the cord's not that long, rah, 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 the baby will still come out. So, yeah, it's just unwrap when the baby's born and then continue on as normal.
I couldn't help but to witness when I started watching free births and home births. I began watching and listening to a podcast called Australian Birth Stories, like when I first, and that was beautiful. Like I learned a lot from that. And then, but I couldn't help to hear how many stories of women saying, but the cord was wrapped around the baby's neck, and therefore, like, thank God we're in hospital, and like we'll say our lives were saved. And then when I went on to in my second pregnancy start to watch free birth videos, and I always say I'm like I feel like I've watched more physiological free births or births outside of hospital. It's like nearly every baby's born with the cord around their neck, and then the mum
Yeah, it's
just
very
pulls it
common.
off, and then
Yeah.
baby goes on their chest. And I was like, oh wow, like this doesn't seem to be like a medical emergency. And I always say I feel like I've watched more like unassisted births than most people inside the system, and it's like, oh, like is this actually really a danger? So I've been really intrigued to know, and I have seen you've shared quite a lot on your Instagram account of women giving birth with the cord around the neck, and they just pull their baby out, unwrap the cord, baby goes on the chest.
Yeah, and I think it's used as a scapegoat a lot of the time when there's so much intervention happening in this birth. And then, you know, the baby's eventually born, either cesarean, forceps, vacuum, whatever, and the cord's wrapped around their neck. They're just like, oh, the reason there were so many issues in this birth is just because the cord was wrapped around the neck, when it wasn't. It was just like a coincidence. And it had nothing to do with the cord. It had everything to do with the intervention. Yeah.
A lot of evidence suggests you should have delayed cord clamping in your birth plan, but why do you recommend not using these terms?
Yeah, delayed cord clamping is clamping the cord after, 1 to 3 minutes. So, like, yes, it's delayed cord clamping, but it's not optimal for your baby. babies are born with 1/3 of their blood volume still circulating in the placenta and the cord. And it's not cord blood, it's not placenta blood, it's your baby's blood. And that's been, their body is not just their body when they're in the womb. Their whole body and their cardiovascular system is their body, the umbilical cord, and the placenta. So all of that blood is circulating in the baby and then through the cord and the placenta. It's the baby's blood. And if that cord is clamped before all of that blood has returned back to the baby's body, the baby's being born losing 1/3 of their blood volume, which if you think about right now draining 1/3 of your blood volume, how you would feel firstly, and secondly, how long it would take for your body to build up that blood back. So I would normally suggest that women wait until their placenta is birthed, until the cord is clamped or cut. And that's something they can have on their birth plan or birth preferences. If they are birthing in hospital, it's easier than saying, I want to wait this amount of time. I just, would recommend clamping and cutting the cord once your placenta is actually birthed. And that just makes it a little bit easier. I guess unless there's, proper emergencies where, baby actually does need some help or, something's happened, then there's a very tiny, tiny, tiny amount of babies that may not be able to get that. But even in cesarean births, women can still have that delayed cord clamping and keeping the baby and the placenta connected until they're ready to clamp and cut the cord.
I recently had a mum who had a cesarean and she opted for that, but they said she couldn't. Why do you think that is?
Because it's outside of the norm.
I don't understand how medical professionals have studied in university for years and years, who we trust. A lot of people have trust and in what they say, and yet I also learned from doing hypnobirthing how important it is for the baby to have their blood for their whole life of immunity because of the white blood cells in that blood.
Yeah, everything.
Everything. What I don't understand is how our medical professionals are saying it's not necessary and they want to cut it quite quickly before that process is finished.
Because they're not taught properly. It's as simple as that. Everything I know now is not what I learnt training to become a midwife. I didn't know half the things I know now. I had to actually unlearn a lot of things and then relearn through experience and through research and all that kind of stuff. They're just not taught those things. They don't appreciate those things. Their obstetricians are surgeons at the end of the day, so they're very medical minded and their profession is surgery. It's not normal physiological birth. So they don't know about physiological births unless they're that rare obstetrician that takes it upon themselves to kind of think about, are all these things I'm doing actually helping women and babies, and kind of doing some self-discovery around that and then changing their practice, which there are, quite a few obstetricians around that are doing that work and will promote as much of a physiological birth as they can. They're still obstetricians and doctors at the end of the day. But a lot of medical professionals that work in a hospital just don't have that knowledge. They just don't know and they choose not to know.
Do you think it works better for the hospitals for women to be having cesareans because it's quicker?
100%. It's easier, it's quicker. You don't have to doctors don't have to come out in the middle of the night because labor and birth can happen at any time and it can last, anywhere from half an hour to, 40 hours or whatever. So it's easier. It makes more money for the hospital, makes more money for the doctors, all of that kind of stuff. You don't need anything for a woman to have a baby naturally. So, yeah.
Why do you think people want to hear the research that their body would just have a baby? I can't help but find people like, yeah, but where's the research on that? And I can't help but to think research and birth just shouldn't even be in the same sentence.
Oh,
Like,
there's so many things. It's like, do you need a study to show it's bad to bang your head against a wall? Like, it's very much common sense. And another thing is that, again, women are so capable if we give them that chance. They're so capable of making decisions. Like, women having babies are not 2-year-old little girls that need to be told what to do and be, spoken to like a little girl. We're grown women that we make independent decisions every single day of our life. Like every second of the day, we're making decisions about ourselves, what we're putting in our body, all that kind of stuff. We're making those decisions on our own every single day, every second of the day, but somehow just because we're pregnant, suddenly we're incapable of making decisions and being responsible for ourselves and our baby.
do you think there's a lack of people wanting to take responsibility for
I think,
themselves and their
yeah,
baby?
yeah, definitely. It can be quite confronting and scary to say to someone or to think like, shit, everything's on me. The decisions I make, it's my responsibility. The consequences, are mine, and you've got to deal with the consequences of your decision making. And I think it's scary for a lot of women. So a lot of women and families, people in general, are very happy to hand over that power so they don't have to take on that responsibility. So yes, I do think that a lot of people, have that, there's that saying, ignorance is bliss. I wish I didn't know a lot of the things I do know, because it would take away a lot of anxiety and stuff like that. But once you know, you can't not know. So, yeah.
It's easy to keep the lid shut, and I think the same too. Sometimes it's a blessing and a curse to know what we know, and yeah, and
Yeah.
going down the rabbit holes. How do you feel like you've obviously gone down a few rabbit holes, quote unquote?
Yeah.
How do you feel like you've come out of them still grounded and being able to live everyday life, knowing what you know?
You just do what you can do, I guess. Like, control the things that you can control and not worry so much about the things that are outside of your control. And just being a good person, I guess. I think I think anyone kind of on this journey have grown spiritually. I guess that would be the biggest thing, is that the spiritual growth that's come from my experiences has been astronomical. And I think that helps a lot as well. Yeah.
So, what's your perspective on due dates?
Oh, another rubbish term. Like, when you research about how they've, come up with that, the due date, and the study that they used to come up with that and how long ago it was, it's just like redundant. It's nice to have like a bit of a guide, but you don't want to take it at face value or use that to be using that, sole date to be making decisions surrounding your whole pregnancy and birth. Yeah, so I don't even like playing that game. If you were playing that game, then, when you start calculating your due date, you're calculating it from the first day of your last period. And I ask everyone in my classes, were you pregnant the first day of your last period? And everyone's like, no. And I'm like, well, that's where they're counting it from. I'm like, you probably conceived 2 weeks after that date, give or take a few days, No one knows. Again, it's not accurate. So then that would bring you to 42 weeks, not 40 weeks.
And the system wouldn't let you get to 42 weeks, would they?
Not without arguing
Intervention.
your point. And there's been heaps of studies. I'm pretty sure it was a Cochrane review of collectively hundreds of thousands of women. And the average time for a woman to labor is around 41 weeks. That's the average. And 25% of women will go over 41 weeks and 2 days. And so another question I normally ask women is, if 1 in 4 women are going over that date, do you think that that's abnormal? It can't be.
have a friend, actually I've met a few people now who've home birthed, perfect, or some have actually had wild and free birth, 43-week babies, and babies been completely fine.
Yeah.
But yeah, in the system, they would have to have it been fighting and yeah, the push for the intervention. But they didn't have their the hospital. They had family and friends also like, what are you doing? Like, this is
Yeah.
risky, this is dangerous, and they had to just shut off from the world. One of my friends' husbands had to turn their phone off and they had to just disconnect from the world until she gave birth. I think she was 43 plus something. I can't remember, but it was
Yeah.
yeah, it was amazing witnessing a woman so unbreakable in her truth, in her power, and that baby yeah, was born perfectly.
Yeah. Last year I had 2 clients that birthed at 43 weeks. Another thing is that we'll never know, like there will never be studies that, they'll do to show when women are actually going to birth naturally, because it's not ethical to do that. You can't be like, one group we're going to, induce, and the other group we're just going to let you go. Even if it's 43, 42 plus whatever, 43, 44 weeks, that study's never going to happen. So we're never going to actually get proper, accurate data on that. It's just not ethical to do those studies. So we're never going to know.
Have you noticed that most people inside the medical system are the ones to have the biggest, highest intervention of birth because they trust in the system so much?
100%. Show me an OB that's had a normal natural birth. There's probably some out there, but there's not a lot. And I know a lot of midwives, unless they're birthing at home, there are a lot of midwives and nurses that are having the most horrible births, which again, I think some of them might see, maybe it was the intervention, but a lot of them are saying like, yeah, this is why I work in a hospital. This is why I birthed in a hospital, because look at what can happen. Yeah.
100%. I noticed that too.
Yeah.
So I'm noticing as well, well, we all know that if you fall pregnant in 2025, there is an extensive list of ultrasound tests, monitoring, and vaccines that women are required to have. Do you think it is all necessary?
I think that it's not black and white. And I have this conversation with all my clients, regardless of where and how they're birthing, is that you have so many options of what you can do. And you shouldn't be doing anything just to tick someone else's box. You should be getting the information, the pros and cons, what you are actually getting from doing that test or whatever, and then asking yourself if that is going to help you in your pregnancy, or is the result of this test going to change the decisions that you make going forward? I think a lot of people do all of that just because that's what you're meant to do. When you get pregnant, you go to the GP, you do a blood test, you pee in a cup, you do the ultrasound, you do the tests, all that kind of stuff. No one even thinks to be like, well, do I actually need it? That answer is up to the woman individually, I think. I would never tell clients, to do something or not to do something. I just tell clients that this is the information. These are the books that I would suggest you read before you make any decisions. There are these podcasts, there are these studies. You've got all the information there. What are you specifically going to get from doing this test? And if it's something that you're drawn to, go for it. If it's something you don't think is necessary, then don't do it. Once again, women are more than capable of making these decisions for themselves. I've spoken to a couple of, potential clients, and one of them said, it's with a lot of questions that she got asked or tests or whatever, she's like, I couldn't really give information, but I just had a knowing, like I just knew what I wanted to do and things that I didn't want to do. She's like, but I couldn't spit off, facts or studies or whatever. She's like, it was just a knowing. And I'm like, that's what you need to listen to. I'm like, if you don't feel like doing something and you understand the risks, the consequences, whatever, and you're happy to take that on, then I don't see a problem. And that's another thing, is that the medical system and these recommendations for all these ultrasounds and tests and whatever, it's all very risk-based. But the risk is not up to the medical system to take. The risk is up to the woman. It's the woman's body, it's the woman's baby. So it only makes sense that if the woman's happy to take a risk, then it's up to her, really. Like, she's the one that has to live with the consequences and live with her decision making. So no one else should be forcing women to do something if they don't actually want to do it.
So it's just coming back to that intuition and staying strong by yourself.
Yeah, definitely. And I don't think a lot of people know the research or lack thereof. There's a book called Gentle Birth, Gentle Mothering by Dr. Sarah Buckley, and she has a whole chapter on ultrasound. I didn't even know the things until I read that chapter, and I was like, oh my God. So that's always, if people are kind of umming and ahhing, do I need all these ultrasounds, like all that kind of stuff? I'd be like, well, if you want some information, this is a really good book to read before you make that decision. Some
You're on your
people
own.
are just not ready to hear or to listen or to like change their beliefs. That is a very confronting thing as well, to be like, everything I've done and everything I thought I knew is actually a lie. That's really heavy. Yeah.
It's a letting go of the ego too, it seems.
100% it's the ego. 100%. Having compassion for yourself, like, okay, yeah, once upon a time, this is what I did. This is how I practiced. This is what I did for my kids. These are decisions that I made for my kids and myself. But you have to, like, there's so many things I did that I wish I didn't, knowing what I know now. But yeah, having compassion for myself, I'm just like, well, I made the best decision that I could with the information that I had back then. And I'm so grateful that I've come along on this journey and I know what I know now, because in the future, I'm just going to make better decisions and I can, help other women when they're making decisions and all of that kind of stuff. So it is a big ego thing. Yeah.
People really, I find in society, like I have shifted a lot as a person, as a mother, and a lot of people like to hold on to the old you. But I remember when you used to say this, and it's so frustrating, especially when you're on your journey of growth, and you're like, well, actually, no, yeah, I remember feeling that, and then I went and learned that, and now I have changed my opinion, and I don't agree with that anymore. But it's as if like people hold you to it and they don't like when you change your mind. And I've, in my own journey, I felt, and I can't imagine what it's like for someone like you who's, you've learnt something and you've done something for so long. For me, I'm only like, this is like, I feel like I've only been in this, like coming into the birth space in the last few years and just like learning about health and the medical system and stuff. But I feel like a hypocrite and a fraud. Like deep down, I tell myself, you're a fraud, you're a hypocrite. You can't believe what you believe now. You can't tell what you tell now because you didn't used to and used to say the opposite. How do you navigate that?
Again, just having that self-compassion and, growth is good. Change is good. And I think when you can acknowledge that and be like, well, yeah, I said those things and I believe those things, but now I know better. Like, that's amazing, because not many people would have the courage to be doing that. And again, I something else that, maybe you need to let go of, or lots of people need to let go of, is what people think about you. I couldn't give two shits about what people think about me or what people say about me, because I am so confident in myself and the person that I am, and I'm only going to be authentic to myself, and I really don't care what anyone has to say, because I know what the truth is. So yeah.
It's a journey.
Yeah.
I go through like these, like, nah, I don't give a fuck. And then I'm like, yes, I do. Oh my God.
Yeah.
So
Yeah.
when do you think the shift happened? Like how long ago in history do you think the shift has happened where birth has become a medical emergency?
I think when birth got removed from the home, it was normal for women to be birthing at home. All our grandmothers were born at home. And if you speak to that generation, you'll hear stories of how it was like a family event. It happened at home. A lot of the grandparents' generations, they would have witnessed their siblings be born as well. And it was a normal thing that used to happen. Then birth got removed from the home and brought into hospitals. And what a lot of people think is like, oh, you know, the death rate was so high when people were birthing at home. And they say that for these days. And I'm like, yeah, there was probably like, you know, higher death rate for everything because of hygiene, because of living standards, because of there was no like sewerage or anything like that. It was just like on the street. So of course, people would be dying from, you know, hundreds of years ago, people were dying from like diarrhea or having like a tooth infection. But that's because of other things, not because of birth itself. Births were removed from the home where, again, there were, you know, wise women, midwives, women were serving women in the community. When birth moved into hospitals, hospitals were only a place for sick and dying people that had infections and all that kind of stuff. Another thing is that in that time, hand hygiene was not a thing in Western society. So there would be so much cross-contamination. Doctors would go from, you know, treating a sick, infected patient and, you know, post-mortems and things like that, and then not changing their gloves, not washing their hands or anything like that, and going to care for a healthy woman and the baby. And there were the, you know, infection rates and mortality rates of women and babies when they were just introduced into hospital were astronomical. And then, you know, it's only taken 2 generations to forget that women were birthing at home and having, you know, 5 to, you know, 15 kids each being born at home. Yeah, and then medical intervention has just increased. Hospitals are profiting off women. Hospitals, you know, the maternity system and hospitals are a business, multi-billion-dollar business. So, you know, it would be a very massive loss for women to then go back and birth at home.
So statistics show that 1 in 3 women have a traumatic birth. How do you think we can get more women to have a beautiful birthing experience?
I reckon that rate is maybe even more.
I think so too. Yeah, because a lot of people don't realize they've had a traumatic birthing experience. I have noticed.
I think a lot of people talk about, you know, we need to make the maternity system better. We need, you know, more midwife-centered care, rah, rah, rah. I disagree. It has to start with the woman. That's where it starts. Doesn't start with a midwife and end with a midwife. Doesn't start with home birth and ends with home birth. It starts with women taking back their power, trusting themselves, having confidence in themselves, having that knowledge and information readily available and being given to women. This is not going to happen in the medical system. The medical system is not going to change. We're not going to rebuild it's just not going to happen. It's not going to change. It's only going to continue on that trajectory of getting worse. The change has to start with women themselves. So that's what I think.
Do you think how we are born has a role into who we become?
I think so. And I don't think a lot of people talk about this or even think about that. I don't know if you know Gabor. Yeah, I'm in love with that man. Just like,
Same.
oh my God.
I think I've mentioned him in the last 3 episodes of in my podcast.
Yeah, his stuff is life changing, and it makes you think about all of these things. You know, when mothers are birthing their babies, whatever their experience is going to affect that child. If a mum is having a traumatic birth experience, is she going to have that same mindset, emotional attachment, hormones, all of that kind of stuff in her postpartum that a woman that had a beautiful, positive, empowering experience is going to have? I'd say it would be very, very different. And children, babies take on so much of their mother. So that trauma can definitely just be passed down. But also the way we're born kind of shapes a lot of things, like our immune system and our microbiome and, you know, just the perspective that your mother has on pregnancy, labor and birth and breastfeeding will transfer to a lot of their children and what their children, especially their daughters, perceive about labor and birth.
So going back to the attachment with a mother, it's very common in today's society that a lot of women have postnatal depression. So perhaps I'm wondering, especially I've listened to a lot of Gabor Mate's books. His book, Hold On To Your Kids, is just my favorite. And I recently went to his talk in Perth. So now I'm wondering when we're, a woman's struggling and she's like, look, she's not feeling that with her baby. Perhaps we should be asking, well, what was your birth like? Was baby put on you? Was it not disturbed? Was baby taken away? Because that has a vital role. Now, let's say that was the case. How can we heal past that? Because me and my daughter were separated for 9 days, NICU in Western Australia, and I know not many NICUs in Australia support kangaroo care where mum and baby are the primal healing. A lot taken away from mum. Mum's not healing whatsoever, and the intervention's more healing for the baby than being with their mum. So whilst I know it is coming in and a lot more hospitals that they're saying, I researched this the other day, whatever, it's never going to be to the degree of what it needs to be. But what was my question leading?
How to maybe heal that connection if it's lost.
Yeah, because I can.
Or if they didn't
sorry,
get
that's
that.
where I was getting at. Yeah, so I can feel there's a difference between my attachment with Ziggy than my attachment with Sage, where Sage was free birthed on my chest. She didn't remove from my chest for 5 days. There was no disattachment, and I can feel there's such a different attachment between the both of us, and I wonder if it comes back to me and her being separated.
Yeah, look, I think about that as well with my births. With Charlotte, I had, although it was, a very nice birth at the end, I did have an epidural, I had the syntocinon drip, I had the syntocinon injection for my placenta. And does that syntocinon affect the oxytocin, which is meant to help with that bonding afterwards? Does the epidural, because with my home births, I didn't have any, pain relief, because I had, all of that intensity and that pain, and you work through that. And then at the end, you get this like massive reward and your baby's born and you get this massive high and you get a surge of oxytocin and dopamine and serotonin and all that stuff. I feel like it's like when ducks are born, they have to like see their mother to then imprint and be like, oh, that's my mum. I also wonder if all of those interventions are then not helping that imprinting with the mother and the baby at birth. Because when my daughter was born, I was just like, oh, cool, like I've just had a baby. Do you know what I mean? But when my sons were born, when they were born, it was just like, oh my God. And you have them on your chest and you're just like, wow. And then you're just like feeling on this high about like, oh my God, I just did that. Like, look at what I just did. So I definitely, I know kind of what you mean. And another thing that kind of pops into my head when you mention that is there's the Midwives Cauldron podcast. There's an episode with Dr. Sarah Buckley, and she tells this story about a mother who she was having her third baby, and for some reason she had to have a cesarean for her third. Maybe it was like placenta previa or something like that. And she had her other two babies naturally and all that kind of stuff. And she said that this mother stated there is something so different about how she felt after the birth of her baby. Like she kind of felt like it wasn't even her baby. And she said that only changed after about a whole week of doing skin to skin. She said after that week of doing skin to skin, which is then going to build up that oxytocin, she goes, after about a week of doing that, I then started to feel that connection. So I think these are the things that we need to be thinking about of how we're going to help women if they do end up with, you know, their baby being taken away, if they're like very premature and they're being taken to NICU, or they've, you know, in special care for a stay, or even with cesarean births, understanding and acknowledging the importance of creating that mother and baby bond and keeping that strong, with skin to skin. Like there are some special cares and NICUs in other parts of the world where they don't even have humi cribs. It's literally a recliner chair where the mother will sit on and stay in for as long as the baby's in there, and the baby's literally skin to skin. There's no bassinets or anything like that. It's these babies are on their mother's chest for the whole time. And, you know, I'm pretty sure from research done in those areas, you can see the massive differences in terms of baby's heart rate, oxygen levels, weight gain. I'd say the mother's mental health as well, and how quickly these babies recover and are able to then leave, you know, special care. So yeah, I think you just acknowledging that and being aware of that would be helping, just that alone, you know, and maybe being worried about, how can I make that attachment with, was it your son or your,
I've got two girls.
oh, two girls,
Yeah,
with
but
your older
yeah.
daughter,
Mm.
just wanting to build that connection is building that connection. Yeah.
Yeah, at the moment I'm trying because I've coming back to Gabor Mate, what he states in his book, for those who are listening that haven't read his book, is that we have raised peer orientated kids because they've lost their attachment with their mums. And so the way I picture it is that we and our kids have these tentacles like jellyfish, but millions of them, right? And they get severed, and they get severed by all these little things, like, and so from birth, not going straight onto the chest, and getting taken away, that's a severing. Then he states that it's the daycare from a really young age, before the age of
Yeah.
3, that's a huge sever.
Yeah.
He even says about, you know, we're putting kids as babies into all these sensory classes, and we're going to these play groups to, he's like, we shouldn't be worrying about this so much. We should worry about our bonding with our kids and us
Yeah.
being there for our kids. And that it shouldn't be about us building our relationship with our kids when we feel the time's right. So after we finish work, or when we feel the time's right, it should be when our kids are yelling out for us, we're there. And
Yeah.
that's going to be building that strong attachment with the, and so I picture these tentacles. So I can't help but to look at the tentacles I have with both of my kids who had such different birth experience, post-birth experience, the tentacles that I feel with Ziggy have been severed, but the tentacles I feel with Sage are still so intact. So even when right now, when and she's what, 4.5 months old, and I'm like, she's not with me right now, I feel so confident in that, because I'm like, she knows she's safe, because she's with her dad and she's just popped out for an hour and a half. There's no one else really raising her. She's exclusively breastfed, like all of these little different things. And I think as a society, we're pushed really as well to pump so dad can bond with baby. And it's like, you know, that hasn't ever been happened before 100 years ago. Like the last 2 generations has only, in the first time in history, has had dad feed a baby, and it's not really natural. But yet I've been criticized. My partner has been said to multiple times, like especially other men, I feel sorry for him that he's never fed our babies with a bottle. Luckily he's so like doesn't
Yeah.
buy
I
into that
can
at
do
all.
other things with my child apart from, you know, feeding them.
Yeah, yeah. And to put that on a mum as well, to put that on a mum that she needs to pump. So, it baffles me. But coming back
Yeah.
to Gabor Mate, actually, I just did this instinctively. But if anyone's listening and wanting to rebuild this is something I'm practicing. And look, I don't even know if it's working, but to me, intuitively it is every night when Ziggy's falling asleep, I'm like, and I'm just telling her in her ear, like, you are safe and mummy's here and mummy's not leaving you and we're together, and just putting that in her head when she's awake and when she's asleep, because I'm like, I know that's landing deep in there, that she feels safe within us, because I have seen her abandonment issues and her anxiety already, and she's not even 3 yet. So epidurals, do you think the risks outweigh the benefits?
There's a lot to epidurals and how they can affect labor. in terms of like the physiology that's happening and what your body's trying to do. Firstly, the oxytocin feedback loop that we have during labor is the more we feel the sensations, the more oxytocin gets released. When we have an epidural and those sensations are taken away, we're not getting that feedback loop. So that's already the first thing that's going to affect our labor. We're not going to be getting that natural hormone feedback that we would without an epidural. So that slows down labor. It then adds the second layer, which is having to put up the syntocinon drip, the synthetic oxytocin drip, to help then bring back those contractions that are taken away because our body's being tricked that it's not in labor anymore.
So this is now already 2 loads of drugs?
Yeah, well, in the epidural, there's, you're having anesthetic, you're having fentanyl, you're having a whole bag of fluids, maybe 2 bags of fluids. Then you're having the synthetic oxytocin on top of that most of the time, which then there's risks that comes with using the synthetic oxytocin, which is a hyperstimulation of the uterus, fetal distress, higher risk of postpartum hemorrhage. So that's on top of it as well. And then you've got the risk of more cesareans. You've got a higher risk of forceps and vacuum because women are not mobilizing and being in a position that they normally would be without an epidural. It's more medically led than intuitively led. So if a woman cannot feel her surges or her contractions, she's not going to feel how to push or anything like that. A lot of the time with an epidural, women are being told how and when to push. Even though if we just left her alone, the baby would eventually come out, whether she can feel it or not. It's controlled pushing or purple pushing. Most women, are being recommended to stay on their back, eventually having their legs in stirrups. So, that risk of having a forceps or vacuum is increased. The risk of episiotomy that comes with that, then that's being increased. There's a higher risk of tearing, again, because the woman's in bed, forced pushing, higher risk of then postpartum hemorrhage. If they're having an episiotomy, they're having more blood loss. It's a snowball effect.
So it's like the gateway drug. But coming back to inductions, have you noticed that a lot more women feel the need for the epidural if they have had the induction because the induction has forcefully brought on labor? I haven't had either. So, I'm curious to know because I can't help but see there's a link. As soon as you have an induction, you end up with the epidural because you're in more pain.
Yes. Women that have an induction will describe their birth as more painful because, again, it's not the natural hormones that are working in the body. It's not the brain working with the body. Body is not controlling it. The baby's not controlling it. It's all through a drip. So, again, that creates its own kind of issues and then leads to interventions like having an epidural, and then again, it's just like a snowball effect. And there are women I know that have had no pain relief when they've been induced, but the majority of women that are having an induction, unless their labor's like very quick, will generally end up having an epidural.
And I can't help but to just see as well the push for the induction. And every woman when they're pregnant, when you ask them their birth plan, they're like, I just want to go into it naturally. Then all of a sudden they've had the baby and you check in with them and they're like, well, we went in for the induction, and they explain the reason why, and it's a legitimate reason. Like what they've been told is, that it's risk-based, right? And then they've had the induction and then all of these things have happened. And then I can't help but to always hear, but, thank God for the doctor and thank God for the nurses. Like, the baby was in distress and the heart rate, which you haven't mentioned, but I was speaking to another midwife the other day who also left the midwifery, says that when a baby even being birthed on your back, the heart rate of the baby, because of the shape of it trying to come out the birth canal, also goes up. So then they say, well, the heart rate of the baby and it needed this and needed that. But it's like, well, if the induction was happening in the first place, would this have all have happened?
Another big risk for that is having a CTG. And knowing what baby's heart rate is doing. It's very common for babies' heart rates to drop as they're getting further down in the pelvis. It's physiological because they're being squished, like through the birth canal. So it's normal for babies' heart rates to dip in labor. But when you're seeing that on a screen, you're more likely to follow the screen and not use your common sense and knowledge about birth physiology. And so you're left with intervention. Without intervention, babies are born with those energy stores to go through labor. Labor's not easy for a baby. I would say it would be, I would use the term traumatic for the baby, but not traumatic in what you think the term traumatic means. Like the baby has to work hard through labor. It has to have its energy stores to get through labor. And babies cope very, very well. But when you're adding external stresses on top of that, so it's not just labor the baby has to go through, it's, having hyperstimulation and having more surges than rest. You're putting that stress onto the baby. You're putting, opioids onto the baby. You're slowing down labor with all of these other interventions that the baby has to work even harder. So yes, if you have intervention in your labor, yes, you're going to need extra intervention because your baby is probably going to be distressed by the end of it. People ask me, well, if all this happens and then at the end they're, suggesting or recommending that they need to get baby out because baby's distressed, can I decline that? I'm like, firstly, you can decline whatever you want. But secondly, if you're consenting to an induction at 39 weeks, you're having your waters broken, you're having multiple vaginal examinations, you're having the synthetic oxytocin drip, then you're having an epidural, then you're laying on your back for 10 hours, then you're pushing when you're not meant to be pushing. So you're putting all of this extra stress onto your baby. Your baby's probably going to be distressed by the end of all of that. So yes, that baby will then need to be born because it is probably distressed. But it's not because of labor and birth. It's because of all of the intervention, the extra stress that was added onto your baby.
And then we wonder why baby's screaming for 6 weeks.
Yeah.
Have you gone into Aware Parenting? Have you listened to any of her podcasts?
No.
She's really cool. Her name's Marion Rose. I've actually reached out to her to see if she'll come on the show too. She teaches you how to hold space for your baby, like in that crying, because it's like baby have emotions too. And most of the time we are told to fix like more boob or more bottle or more dummy, or just if the baby's crying, it's like, what's wrong with you? As opposed to listening and holding a safe space for baby and their emotions, especially listening to everything you've just said about what's going on for the baby. And I guess I can't help but put my viewpoint from that baby's perspective, where I don't think a lot of our society has no perspective on the baby's viewpoint and what's happening to the baby because they can't talk and they can't speak and they can't.
Well, that's just like a very woo-woo concept, isn't it? So if you're not, open to that conversation or that way of thinking, then you're going to think that's ridiculous.
So from a midwife perspective, how do you feel about that perspective?
I'm open to that 100%. And I'm like, oh my God, that makes so much sense. So definitely, I think, babies hold a lot of tension and subconscious memory that's stored in their body as well. And I'm working with my clients, I don't really focus on the physical aspects of labor and birth because my belief is that your body's perfect the way it is right now. We don't need to work on your body for you to birth your baby better. What we need to do is work on this. And I go through like, do you know how you were born? What's your mother's perspective on labor and birth? What was your birth like? Have you spoken about that? Were you and your mother separated at birth? Did your mum sleep train you? Did she do cry it out? All of that kind of stuff. And it's not until you just see the wheels turning, and then my clients are just like, I was left to cry a lot. Maybe that's why I have abandonment issues and feel like, it plays a role in their relationship with their partner and all of that kind of stuff. So definitely we have to be looking at the baby and child's perspective, 100%.
I want to get onto episiotomies. What is your
Uh,
viewpoint on them?
oh, they're disgusting. I think it's barbaric, and I think it's mutilation of women. I don't think I have ever seen, now looking back what I know now, I don't think I've ever seen an episiotomy that was actually necessary. The rate of episiotomies as well, I was looking at the statistics of birth. I look at them every year, and it was like 25% of women were having an episiotomy, like mind-boggling. I couldn't think less of them.
I can't help but to get really emotional right now because as a mum, again, I haven't birthed in the system, but I cannot even imagine what it must be like for women who is listening to this or just in the world. And this is a huge percentage of women that, whilst pushing a baby out of them, has had somebody else touching them, especially
Oh,
coming in and cutting them. Like that is so traumatic, so traumatic. And
the
yet,
sound, like the sound of an episiotomy is like ingrained in my brain. It's like horrific. So I couldn't imagine being the woman, especially, without pain relief as well, and then declining it and not wanting it, but it being forced on you. You're coerced to be cut, or you're pressured, or you've said no, but someone's done that to you anyways, regardless of you saying no. I've had women pleading to their partner, like, don't let them cut me, don't let them cut me. And it's been done anyways. It's really not nice.
someone's listening to this and they're kind of realizing that happened to me and I didn't even realize because a lot of trauma response is to shut these memories off. Where can people go? Because they need to go talk about this because this is, to me, I'm calling it as it is. This is rape. And just because it's been done by a medical professional doesn't mean it's okay. It's fucking
Yeah.
rape.
Yeah.
And you
It's
have been,
illegal. Like you shouldn't, even in my classes when I'm demonstrating massage techniques or hip squeezes, or if I'm, showing women how they can measure their own, fundal height, before I even touch them, I'm saying, is it okay if I touch you? And they're looking at me like, why are you even asking? Like, of course it's okay. And I use that as a teaching, like a learning experience. And I'm like, no one has a right to even touch you or to walk into a room that you're in hospital without asking your permission. So, a lot of the time, and again, I can say this very confidently because I know I was guilty of this, of, seeing women in hospital during their pregnancy and being like, oh, I'm just going to take your blood pressure, or I'm just going to measure your baby, or I'm just going to check your baby's heart rate. That's not consent. It's definitely not informed consent, but it's not even consent at all. So just because you're pregnant or just because you're in labor or birth doesn't give anyone permission to touch you or to do anything to you.
if you've had a friend that's gone through this and they're struggling, how can we be a safe space and hold them through that? Because I think as a
Mm.
woman, I'm trying to learn how to get out of my masculine, be in my feminine, just be there for women as opposed to be the to-doer, the to-deller,
Yeah.
the teller, the teacher, the guider, and leading women back to themselves. But I am struggling. Can you please give me some tips on how I can be better for women who have gone through this without being like, well, if that first part of wouldn't have happened, do you know what I mean?
I think it's just gauging their responsiveness. So just firstly, just listen. Just be there to listen. Um, and like maybe asking gentle questions, like if something traumatic did happen, instead of being like, well, this is why, like it's your fault. You decided that, that's exactly why. You know, again, having that compassion. And just listening, like, how do you feel about that? Like, are you all right about that? Just let them talk, because I think it's when people are talking and debriefing, they're processing it. And sometimes people need to share their story or talk to people, you know, 5, 10, 15 times before they start realizing like, oh, like maybe that didn't need to happen, or like then they might ask you something. So I know people know what I do, family, friends, they know what I do, they know my opinions. But I will not, I have the mindset that people know what I can offer them and the knowledge and information I have. So I'm not just going to say things to them or give them information unless I can see that they're actively seeking that or asking me questions. And then I will, you know, say a few things, and then I'll kind of just gauge their body language or the language that they're using to know whether to keep going and give them a little bit more or ask them a little bit more questions or pry a little bit more. But if I know that they're just not going to be responsive and they just want to tell their story, then I'll just be there to listen and that's it. Even though I want to say all these things, I've had to learn to bite my tongue a bit and just be like, it's my turn just to listen. If they want extra information or they want answers, they will ask or they'll show me some signs that they're ready to kind of dive in a bit deeper into their experience. But just being there to listen without judgment, without anything, because chances are there are a lot of women that are telling their story that feel so guilty if they had an induction or, you know, they had a cesarean. A lot of women are maybe internally feeling so guilty. They don't need other women or friends or family, again, even subconsciously putting that judgment onto them, because that would feel really shitty to be that woman. So just listening. Sometimes if I'm listening to stories and I'm just like, I know you're not ready to hear the truth, so I'm just going to sympathize with you and being like, you know, not saying, well, lucky you were in the hospital and rah, rah. I'm just going to be like, you know, thinking about what support they need. If you ever want to talk about it more or you need to, you know, tell your story again, I'm here to listen. You know, maybe try journaling about it, like all these other things without kind of saying, well, it was, you know, this is why that happened. Yeah.
I have some statistics here on cesarean because I wanted to do some research before jumping onto this podcast with you. So, as of the most recent statistics available, approximately 39% of births are cesareans in Australia, where the US is 32 and the UK is now 42%. Do you think all of this is from a medical cesarean, or do you think a lot of this is again from the cascade of unnecessary intervention? And another question is, why do you think women are also opting for cesarean without even giving birth a go?
I think the reason women would be choosing to have a cesarean is, again, fear and lack of education or lack of knowledge. Not that they're not educated, because I think a lot of that percentage of women that are choosing to have a cesarean are very educated, but then they don't have that knowledge or information on the risks or the consequences, the long-term health consequences that are happening for their children, and fear of, you know, birth itself. The reason for an increase in cesareans, again, it's just that medical intervention. Women are seeking out medical support. Most women are booking into hospitals. All the things that happen during pregnancy, the inductions, all these extra tests and things, everything is attributing to the higher rates of cesarean. But when you look at the statistics, the reason medical maternity system is recommending inductions and cesareans is to save more babies and mothers, yeah? But we're not seeing the mortality rates decline as these interventions are increasing. So we're not actually saving more mums and more babies. We're just having higher rates of intervention. So that right there tells me that they're not necessary because we're not improving outcomes.
So whilst I was researching, I also came across the stats that women over the age of 40 are 47% more likely to birth via cesarean. And in Australia, that was in the US, in Australia, the rate is 57%. How do you feel about these stats? And do you think there's a risk in birthing at a later age?
So my opinion is that our body is so clever, and if a woman is falling pregnant naturally, right there and then is the proof that her body is capable of growing a baby and birthing a baby. If her body was not capable of doing that, then she wouldn't fall pregnant.
I mean, so what's your view on the childhood vaccine schedule?
I still hold a nursing registration with APRA. Um, so anyone that holds a APRA registration have to follow the recommendations of the government, which is the childhood immunisation schedule. So we cannot go against that recommendation from the government and the immunisation schedule. We can only recommend that.
So for women wanting a physiological rebirth, but still wanting a midwife present, when choosing a midwife that you can trust, what should you look for?
So again, I think free birth is not for everyone, and a lot of women still want that support of a midwife. There's absolutely no right or wrong, but women have to understand that midwives hold a registration and they are bound by that registration and therefore bound by that kind of rule book that comes from that. They have to follow certain policies and guidelines and procedures. And in pregnancies and births, I think being bound by that registration can stop midwives from being able to authentically support women on how the woman should be supported. So I do feel sorry for midwives that are practicing because, you know, sometimes they are stuck because if something happens, then they're held accountable and it's their registration on the line. So the majority of midwives are going to be choosing their registration over the woman, unfortunately. But some things to ask is, you know, all of the curveballs, all of the like what ifs. So the woman needs to think about what type of pregnancy and birth she wants, even at home. And, you know, if she doesn't want certain tests and stuff in the pregnancy, you'd be wanting to ask the provider, are you happy if, you know, I decline X, Y, or Z? What happens if, you know, these things kind of pop up in my pregnancy? Is this something you're comfortable still supporting, or is this something you would have to drop me for? Are you comfortable supporting me if I go past 42 weeks? What does your support look like if I go past 42 weeks? What happens if my baby is breech at the end of my pregnancy? Are you comfortable supporting a breech birth? What happens if, you know, it's a surprise breech? Are you trained in breech birth, or what's your, you know, guidelines around that happening during my birth? What if there's meconium during my labor? What's your thoughts about that? What's your protocol around that? What if my waters are open for, you know, longer than 48 hours? What are your guidelines and protocols about that? So asking all of these things that, you know, the rug kind of gets pulled from a lot of women that are planning home births that have hired a private midwife when push comes to shove and, you know, one of these curveballs kind of pop up. The midwife's like, oh, I can't support you doing that. So, you know, I can't support you anymore. Or I'll support you in the hospital, but I can't support you at home. And then women are left at, you know, 36, 37, 38, 39 weeks, being dropped by their midwife. And what are they going to do? So asking about all those different scenarios is going to help you understand what type of midwife they are and what their perspective is, you know, on all of these variations of normal. And then just interviewing a lot of midwives. And I'd even tell women, like, when you think like, yeah, I think that, we're going to start trying for a baby, that's when even before that is when you need to start planning for your pregnancy and gaining all that knowledge and information and all of that kind of stuff. So preparing before you're even pregnant. Interview a whole bunch of midwives. If you want a doula or birth keeper or whatever, interview all of them, meet up with them. With my potential clients, I will never book them in before meeting them face to face. So it's like a no pressure meeting where we meet up for a coffee, we have a chat. I ask them about, what their expectation is, what support they want from me, what their expectation is of me, if they have any questions, all of that kind of stuff. And I just kind of see if we're on the same page, if we kind of gel good together. And there have been some women where I've been like, look, I actually think you're better suited to hiring a private midwife, or I reckon you would really suit this other, another friend that I have that's a birth keeper or doula. I reckon, you would really get along with them. So it's about what that feeling is when you're meeting people. So don't just book people in or go with the first person that you talk to. I would always encourage potential clients to chat to a few different people and see who they feel most comfortable with and what energy vibes with them more.
If a woman is quote unquote high risk, e.g., has had a cesarean, has torn second or third degree, or has had gestational diabetes throughout their pregnancy, anything that classifies them as high risk, do you see that as not safe to birth at home for their future babies?
So again, these are all like medical terms and medical classification of what is high risk. It's again, I'm a doula. I don't give out any medical advice whatsoever. And midwives, like, yes, they have certain guidelines and policies to follow, but it's only their job to provide the information to women and to say, this is what I have to recommend to you. According to, Australian guidelines, this certain thing puts you in a high risk category. This is what I have to recommend to you. But it is up to the woman to then accept or decline that recommendation. So the job the midwife has is to offer, and it's the woman's job to accept or decline. It also, like, everyone's very different. So something that I would think is risky, another woman would not think is risky, and vice versa. So it's very individual. And again, I don't think there's a right or wrong. I think the important thing is women understand all of their options. They have pros and cons for each option, and they make the decision for themselves. So if you were to ask, one person, is it, gestational diabetes high risk? For an obstetrician, yes, probably. But if you're using your common sense, gestational diabetes or diabetes is only an issue if the sugars are not controlled. Whereas a woman can have gestational diabetes and her sugars be normal for the whole pregnancy. Well, there's no issue really because everything's normal. So there's not going to be any higher risk of having a bigger baby just because you have gestational diabetes. Or when looking at the research for having a vaginal birth after a cesarean, to an obstetrician or to a doctor or to some midwives, it'd be like, oh my God, that's so risky. Birthing at home, you could have a rupture, this, that, blah, blah, blah. But when you look at the actual statistics, it's like 0.5% chance of rupturing or something like that. All different studies have different percentages, but it's something like 0.3 or 0.5% chance of a rupture. You have a 99 point, something chance of not having a rupture at home. So is it really, high risk to be doing that? Again, I think that decision should be up to the woman.
If there's a midwife listening and wanting to step away from the system but scared, what would you say to them?
It takes a toll on you, not being authentic to yourself and to your morals and to your beliefs. It really does take a toll, and it's very depressing being in a place, seeing things you don't want to see, doing things that you don't believe in. that really can take a toll on you and your mental health. So um, having a lot of courage, I think it takes a lot of courage to kind of walk away from something that's familiar, and stepping outside of your comfort zone. But I think that's where the most growth happens, is when you do step outside of your comfort zone, um, and be more comfortable in the discomfort, because you will grow so much and you will learn so much, and you'll also be helping more people when you are being authentic.
I heard a term not long ago that it's like when you are being authentic, it gives permission for other women to be authentic.
Yeah, definitely. And it's like so freeing. It's so liberating being able to speak your mind and say what you feel is true. It feels really good as well. And then to have other people resonate with that, feels really good as well.
So I'm intrigued to know, what do your parenting choices look like, from birth to sleeping to feeding, up until toddlers? Like, what do you feed your kids?
Well, that's changed a lot in the last few years, especially, having Charlotte nearly 9 years ago. I was very medical minded, birthed her in the hospital, had all this intervention, all that kind of stuff, to now having my third baby, which I free birthed and, all that kind of stuff. I didn't co-sleep with Charlotte. I did exclusively breastfeed, but I didn't co-sleep with her. I didn't sleep train her either. It just didn't feel right. And I think that's another thing, is that mums know, like mums have this knowing, this intuition where you can't explain it, but you just feel drawn to something, or something just feels wrong in your body. It feels wrong when you leave your baby to cry. Like, no mum can tell me that that is a good feeling when they've sleep trained and they're listening to their baby cry from another room. That feels wrong to your core, and it feels wrong for a reason, because your biology is literally screaming at you to go pick up your baby. So I think women and mums also, some people need to be told that. Like, if something feels right to you, go with it. If it feels wrong, don't do it. I have some clients where, for the postpartum visits, I'll go to their house and I'll be like, do you want to go, I can keep baby company, and you can go have a shower, you can go for a walk, you can go for lunch with your husband, whatever, and come back, all that kind of stuff. And some mums just do not want to be away from their baby. And that is totally fine. That is normal. When you go to family functions and you don't want to let anyone hold your baby, and you just want to hold your baby 24/7, that's not wrong. That is normal. And that is okay. So I think, again, women just need to listen to their body, and listen to their intuition, because it's always going to lead them to what they need to do, especially in how to raise your children. Like I said, Louis was my only baby that I co-slept with. And even though, he was waking up multiple times and it would be so nice to have a bed to myself, I actually didn't want to not co-sleep with him. Even though it was hard, I just knew that that was the right thing to do, because it felt right. I felt so good being next to him in bed and having him close to me. And I think a lot of women know what I'm about to say right now, is that when he wasn't sleeping with me and he would fall asleep and then I would go into my bedroom, I would have anxiety, because I'm just like, is he alive? Is he breathing? What if, he rolls onto his, face, and all this kind of stuff. And I'd wake up so many more times during the night, because I wouldn't know, what he's doing, where he is, what position he's in, anything, because he wasn't right next to me. So even now, Louis is 2.5 and he still co-sleeps with us. And I have the cot right next to my bed, but I never put him in the cot. I want him next to me. So, and that feels right. And so that's what I do.
When I had Ziggy, I hadn't really opened my a viewpoint into, I guess, quote unquote, conscious mothering or attachment mothering, or whatever you want to call it, like in the society there's a lot of labels like crunchy, I don't know, whatever you want to call it, but attached parenting, I hadn't at all. And we had the NICU experience for the 9 days, so I had to drive home an hour and a half each way, then go back to her. Anyway, when she ended up coming home 9 days later, she was in the co-sleeper next to me, but I couldn't sleep with her on me or near me. That I actually physically couldn't do it. Then I went on to build a network, a community of all mums who were raised holistically, like, again, quote unquote, holistically, raised by gentle parents, raised by parents that slept with them, or had babies older than mine who were all co-sleeping. And I remember being like, oh, like Ziggy's in her own room. And it was like, what? And I was like, yeah, like, and at first I thought, this is great. I get sleep. They might not get sleep. I get sleep. This is great. Now, seeing her, she cannot be left in her room alone because it's broken her from me being disattached to her. Yet with Sage, again, birthing her, climbing into bed, having her on my chest, sleeping on my chest, which again isn't allowed like in society, but sleeping with her on my chest and having that. And now, so my partner sleeps with Zig in another room and I sleep with Zig in my room, which again is a whole nother controversy in itself. And I have her next to me and I can't help but to go, oh my God, am I gonna fuck this up for myself? Am I gonna create a bad sleeper? Am I gonna regret this? But I'm like, I don't want her anywhere else.
Yeah, and
So
that's the thing, like we have this idea that like we're creating bad habits, but it's got nothing to do with creating bad habits. It's got to do with creating connection.
yeah, it's really
Yeah, we focus on that
remarkable.
like lack of sleep. Like, don't you want to get sleep? Or like you're going to set them up to be so attached to you and rah, rah, rah. And it's just like, well, what's wrong with that? Like, of course I want my children to be attached to me. Yeah,
Yeah,
it's very backwards thinking.
I actually realized there was something wrong with me. I was like, there has to be something wrong that I can't even sleep with my baby. Like, there's something wrong there. And so I've really started to go into that. And I know if I spoke to people, they're like, no, it's fine. Like, but, and I'm like, no, I can feel it. There's something wrong and I want to heal that. That's, even though she does my head in, she's a helicopter and nah, I can't sleep next to her now. But I'm like, Sage, like, I just can't. We wake up and we're like intertwined and it's just the best. And even when get out of bed and she's on the bed and I look back and see her on the bed, I'm like, oh my goodness, this feels so good. So coming back to you, how do you feed your kids? Because I know there's so many people out there so torn. How do we feed our kids healthy? What does it look like for
Like
you?
my kids or when my babies started eating solids.
Let's start from solids.
Solids. So I never fed any of my kids rice cereal. Again, I didn't really know too much about it, but I'm just like they can be eating so many different things. Why the fuck would I start with, you know, with this stuff? Just like, wouldn't it be better to just give your kid some vegetables or something, like starting? Um, so I think even without knowing what I know now, I would have fed my kids, avocado, pumpkin, even like peanut butter. I didn't know you were meant to like put it on the hand and then, give them a little bit or whatever. I just put peanut butter on toast and like gave it to them, or eggs. You've got to cook them or whatever. Scrambled eggs, all this kind of stuff. So I was already kind of doing that anyways, because that's just, again, it's what felt right. And I think my personal opinion is that I think waiting to when your child is developmentally ready for solids, then giving them solids, not at 4 months giving them purees. I think, yeah, that's my opinion, waiting for the signs of readiness. And then that's when baby-led weaning becomes easier because you can, your baby's developmentally ready to eat food. They can do it independently. And then focusing on nutrition. So, slow cooked meats, bone marrow, proper, organic grass-fed butter, meat, high iron foods, all of that kind of stuff. In the last couple years, my whole household has really changed in terms of what nutrition means and what healthy food actually is. My son, my second, he has some developmental delays. Not like huge, massive, but there are delays there. And he's like a hyper child. So I'm like, let's change his diet. And it's not like I didn't think we were eating unhealthy. My kids didn't, have like Cocoa Pops and Fruit Loops, and they weren't having like white bread with Nutella and, you know, all that kind of stuff. I thought we were eating healthy, but looking at all of the ingredients in foods, 95% of packaged foods are rubbish. I went down the rabbit hole of like seed oils and, organic versus non-organic and, how we grow our wheat and, all the sprays and things that our food has on them and the effect that that can have on children and their brain and their development and all that kind of stuff. So it was mainly for my son, that I told my partner, I said, I'm throwing out everything packaged in our pantry and we are going to eat mainly organic because I want to see if this helps Raf. And he also had a massive sweet tooth. So I'm like, I don't know if he's even going to eat food if I take all of this stuff away, but we'll see how we go. And it took a while for his palate to kind of get used to whole foods, cooked at home. Like if you want a meal in my house, if you want food, you actually have to cook it. There's not much that's packaged. I haven't gone down that route of making, my own sourdough, but the only bread I will give my son is organic sourdough bread. He doesn't have any type of takeaway food. He doesn't have any dyes. I make sure he's not having anything that's fortified with folic acid. Once I changed his whole diet as well, his wasn't as hyperactive, especially in the morning. Making sure you're feeding your kids protein and fat in the morning is really, really important. We don't eat any seed oils. The bread in supermarkets is not bread. I make sure that most of the produce that we get is organic, and it makes a massive difference. Like if you look at seed oils, their half-life is 2 years in your cell. Like that's just their half-life, and the inflammation that they can cause and stuff. Again, controversial, but that's what I believe. And yeah, I think the issue that a lot of people are having with their health is that there's so much inflammation, and it comes from the food that you're eating and your diet. Like there's so many kids where their parents are like, oh, my kid's like definitely got ADHD. And I'm like, how about you just change their diet and see if that makes a difference? Like just start there. That's it. Just start there. Just change your kid's diet. Yeah, I don't know if that answered your question, but
It sure did. It sure did. And to touch on the ADHD, it's like, when are we going to stop thinking about changing the child and not changing the environment it's in?
oh, 100%. Like every boy has ADHD in school because, of course, 6-year-old boys, even there's a lot of girls, if I'm not interested in something and I don't want to sit down and do, what someone's telling me to do, I'm going to fidget and not want to be there and not pay attention. So, yeah, I think we try and fit children into a box where we're not meant to be, putting them in a box.
No, definitely not. So how do you balance between your business and serving women in the community and also raising babies?
Yeah, it's a hard one. It's not, clear cut, and there's no easy answers. I don't think we can do it all. Just in general, like that mental load of the household and raising kids and cooking and cleaning and groceries and all that kind of stuff. I don't think we're meant to even be doing that alone, let alone working and doing all that. And I've learnt last year that when you're doing a lot of one, the other one just naturally will be lacking your attention, and vice versa. If I have a week where I'm busy at work, my house is trashed. The laundry is not kept up to date. Like, I'm not cooking as much as I, normally would and stuff like that. So it is a really, really hard juggle. And the thing that keeps me going is the passion that I have for what I do and also having the support around me. So I'm so, so, so lucky. I'm like more fortunate than most that I have a very good support system where I have a lot of people that help out. Parents, grandparents, family, siblings, all that kind of stuff. So I'm very lucky. If it wasn't for that support system, I definitely wouldn't be able to do what I do. And fortunate that my partner is a very good provider, so it allows me to to do what I want to do and live in this la la land where I can just do what I want to do and everything's kind of just sorted. So again, I'm very lucky. I don't think a lot of women have the support that they need to be doing things that they want to do. I also don't think it's necessary for, like, some women don't want to work. Like, they want to be at home. They want to, raise their kids. They want to homestead. They want to do all of that kind of stuff. And that is amazing. And I think there should be more resources available so women can stay home and raise their kids and, raise their, like, be at home and do all that kind of stuff, which I love doing, but I also love the work that I do because it's more of a passion than a job for me. But there has to be balance. I learned last year I took on too much. Yeah, I knew that my kids were not getting as much attention. So this year I've kind of changed and I've realized that while my kids are little, I want to give them as much as I can. So they will generally come first, and then whatever capacity I have left will then go to clients and work that I do and stuff like that.
So what do you do and how can people come to you? How do you serve the community and where can people find you?
So my biggest presence is on Instagram, and my handle is at the.midwifemummy. I teach my childbirth classes, so I teach hypnobirthing and I do them face-to-face every couple of months, which I absolutely love. And then I also provide doula support for women, no matter how they want to birth or how they want to go about their journey or experience. Yeah, so just reaching out to me on Instagram or emailing me, and my email is beyondbirthing@outlook.com, and that information is on my Instagram as well. So my DMs are always open. I love chatting to women and messaging women and hearing stories and having, amazing conversations. So my DMs are always open.
Thank you so much for coming on the show. I'm feeling like emotional, but I'm feeling high on life. I'm feeling all of the feelings. So thank you so much.